Hi everyone, welcome back. And today we are at Brunner Court Dental Practice, and I'm here with Matt, who's my lifestyle coach. And we were just discussing a case that I'm doing at the moment. And I'll just give you a little bit of background. So this gentleman came to see me around 3 years ago, and he had a failing upper and lower dentition. And what we did was we made him some implants with bridges. So we had an upper and a lower implant bridge made. So that's what the implant bridge is. And he came back recently to see me with one of the teeth had a slight chip on it. So to repair it, what we did was we took the permanent bridge off, we put his temporary bridge back in, and then now this permanent bridge is back and he's going to come in and we're going to fit it in. So Matt, do you have any questions for me regarding this?
A couple of questions. First of all, the process of taking an implant in and out, and obviously the replacement temporary implant.
Yes.
So if you go into a dentist, my experience is either anaesthesia or local anaesthetic, you're out, you've got recovery time. How long does it take to take it out? How long does it take to put something back in?
Okay, that's a great question. Thanks, Matt. So what happens is that's what the bridge looks like. And so what we have here is access holes in which we can access the bridge. So when you look at it from the front, you can't see that. These access holes are normally filled with a white filling material called composite, so they're not visible in the mouth. So to take the bridge off, it takes me around 15 minutes. And what I normally do is remove the composite, and then I just unscrew the bridge. There's no anesthetic involved at all. We send this bridge off for repair and it's back within 2 days, and the patient is back next week with me and we're going to fit the bridge back in.
So then the other question I had was, the material of this tooth is stronger than a normal tooth.
Yes.
So he's chipped it because he's bitten down harder than he would normally bite down.
Absolutely.
So it gives you a little bit more confidence in chewing.
Yeah, so eating is not a problem. So when you have these kind of bridges in, we normally say that something can always give, and this is a shock mechanism. So rather than the whole bridge snapping off with too much pressure, what happens is these bridges are designed so that if you put too much pressure, a tooth can snap off, but then we can get it repaired quite easily and quickly, in which we send it to the laboratory, we drill the tooth off, put a new tooth back on, and then we're good to go again.
So it's literally convenient for the client to it's just take out. Someone else is doing their job. They're still rocking around with a set of teeth that's still fitted to them.
Absolutely, absolutely. So they still have a set of teeth that are fitted, and the patient still has something in their mouth. They're never left without teeth, which is very important. And also, it's important to know how implant bridges are maintained and in the way they are built in order to withstand forces. So we know that putting a lot of pressure can fracture, just like you can fracture your teeth. We can also have a few fractures in these bridges. But the way we design them is that they can be repaired very easily.
And they're handmade.
Absolutely. So what happens is underneath here we have a chrome framework, and then we have individual teeth that are put on there. And then the pink that you can see, we have it painted. So it's a painted pink composite on there that makes it look very lifelike.
Because it may look different on camera, but seeing it in life, from the front, it literally looks like a jaw. It looks like it is flesh and actual bone.
Absolutely, absolutely. So we go into a lot of time and effort, into a lot of detail to make sure that we get this teeth looking as natural as possible.
And with the cleaning process, as in the patient's self-cleaning process, is that different to any normal teeth? Are there specifics that they have to go into?
Absolutely. We always recommend to all my patients is that when they have our implant work, we normally tell them to see the hygienist every 3 months, because we have to teach them how to clean underneath that bridge, which is slightly different to cleaning your own teeth. And it's very important for maintenance to make sure that we keep the implant surfaces as clean as possible on the outside. That's great.
Yeah.
Okay, have a nice day, guys. Bye.